Today I'm going to present on one paper to compare the efficacy and safety of transdermal buprenorphine patch to the conventional analgesics after operative fixation for extracapsular fracture of femur. So fracture of femur is one of the most common geriatric fracture. Nowadays, the fracture of femur can be extracapsular like intratrochanteric or intracapsular like transthoracic subcapital. Extracapsular neck of femur is often associated with severe pain. So standard practice regarding management of this patient is to operate them as early as possible and to start early mobilization, so that to prevent the complications of prolonged immobilization. Then most of extracapsular fracture neck of femur occur in elderly. Almost 40% of these have concomitant varying degree of chronic kidney disease or insufficiency. So NSAID, non-steroidal anti-inflammatories, are contraindicated in this patient. So another group of analgesic medicines, like mostly we use opioids or the tramadol. Okay, constraints in using NSAIDs and opioids necessitate the use of paracetamol and weak opiates like tramadol in management of post-operative pain in this patient. Paracetamol has upper ceiling of 4 grams that can be used in 48 hours, 24, and transdermal buprenorphine patch has been mainly used to treat patients with chronic pain. Very few studies are available for safety and efficacy of the transdermal buprenorphine patch. Okay. Then aim of the present study is to compare the efficacy and safety of the TBD patch, transdermal buprenorphine patch, to conventional analgesics for operative fixation of extracapsular fracture neck of femur. To the best of our knowledge till date, there is only one study which assessed the safety and efficacy of the TBD patch, which was 10 microgram for the post-operative analgesia following proximal femur fracture, both intra and extracapsular. Materials and methods. This prospective randomized control study used done on 60 patients. Operative fixation done in the form of proximal femoral nail or dynamic hip screw. Patients were randomized into two groups after obtaining local ethics committee approval. Group A received conventional analgesics, whereas Group B received TBD patch in the post-operative period for 2 weeks. Patients requiring hemiarthroplasty and patients with ASA grade 3 or greater were excluded from the study. Patients enrolled in the study received a femoral nerve block 30 minutes prior to introduction of anesthesia and under peripheral nerve stimulator guide with 15 ml of 0.125% buprenorphine. Surgery was conducted under spinal anesthesia with 2.5 to 3 ml of 0.5% heavy buprenorphine. Group A patients received combination of IV paracetamol 1 gram TID and tramadol 50 mg BID for first 48 hours, followed by oral formulation in the dose of 650 mg acetaminophen plus 50 mg tramadol 3 times a day for 14 days. Transdermal buprenorphine patch of 5 microgram per hour was applied at the end of surgery in Group B patients. The same was replaced by another patch for the end of the first week. The second patch continued post-op day 14. Vital parameters pain score was by VAS scale were observed at the end of surgery. One spinal anesthesia effect were off and 6 hourly for the first 20 hours, followed by 12 hourly score till discharge and daily 1 score till the end of 2 weeks. Pain scores at the rest and the movement were recorded separately on at least 2 occasions in every 24 hours till discharge. Rescue analgesia was in the form of IV or oral diclofenac 50 mg in either group. This was given if VAS score was greater than 6, and if VAS was greater than 5, then additional dose of NSAID as a secondary rescue anesthesia. Primary target was to maintain pain score less than 4, VAS score less than 10. Results of statistical analysis was done by chi-square test, and then p-values less than 0.05 is considered significant. So there was no statistically significant difference between Group A and Group B as compared to pre-op. So baseline preoperative VAS scores were similar in both groups. VAS score was 7 to 10 with mean of 6.7 and 7.1 in both A and B groups. Similarly, after complete recovery from spinal anesthesia, mean pain score was remained considerably lower in Group B as compared to Group A. So this was the preoperative evaluation of the patient. This was the mean pain intensity at rest measured on VAS scale. So preoperative it was there is no significant difference. So post-operatively after 6 hours when the spinal anesthesia was off, it was Group B patients had complete more pain relief, post-operative pain relief than Group A patients. Then this was pain intensity on movement. Okay, this also continued to follow the same trend with the Group B having less pain. Comparison of post-operative anesthesia requirement. In this, the Group B patient required less rescue analgesia like diclofenac anything, or this was the graphic representation of the same thing. So we conclude that TBD patch is safe and effective for post-operative pain following operative fixation for extra capsular fracture fever. It provides superior analgesia, better patient satisfaction, and lower incidence of adverse side effects as compared to conventional analgesics.
Yes.